Mental health treatment is evolving, and NeuroSpa Mental Health and Wellness is helping patients explore new options for healing. And joining us today are Elizabeth Viggins and Amanda Calta to talk about ketamine therapy and how you're combining it with different kinds of treatments to really make a difference in people's lives. Great to have both of you here today.
Thank you.
Elizabeth, I'm going to start with you to really get to the details of what ketamine is. Ketamine, excuse me. I want to call it ketamine, it's not mine. All right, ketamine, what is it? What's sort of the history and how does it work?
Well, from a psychiatric perspective, ketamine has been described as probably one of the most significant developments in psychiatric treatments in the last few decades. From a pharmacology perspective, it's considered a dissociative anesthetic, but it has been used safely in medicine since the 1960s. Most recently, ketamine has become popular because it's been found to be very safe and effective and used as an off-label treatment for patients that struggle with depression, anxiety, and post-traumatic stress disorder.
Okay, so how does it work? You administer it to a patient, and then do you sort of walk them through talk therapy?
Yeah, and Amanda's gonna speak to that. But as far as how ketamine works, it is very unique, and it differs substantially from traditional antidepressants that take sometimes 2 weeks to 2 months to be effective in the neurotransmission modulation. Ketamine primarily works on the GABA brain system.
It's interesting.
Yeah, it's very interesting. And patients that struggle with depression and anxiety and PTSD can sometimes find symptom relief in the matter of hours to days following the treatment.
So they get the treatment and they walk out and they're feeling better in that amount of time. That's remarkable.
It's pretty spectacular.
Yeah. So Amanda, who is this for? And again, how is it administered? What do they go through in terms of the talk therapy portion?
Yeah. So I would say this is for anybody who feels stuck. Anybody who has engaged in treatments in the past and really hasn't experienced relief or success. So traditional antidepressants, even in some cases therapy and antidepressants, this is a very different treatment. So
it seems like with some of the antidepressants that you might be on for a long period, then you have to take that all the time. But this is a one time you go in, you do it, maybe you want different sessions. Does it work like that too? But it's not something you have to take every day.
It's not every day. And typically we do an induction period and then we kind of take it from there and we see what you need. So sometimes patients are in remission from depression for a very long time and they don't need to do anything. Sometimes they'll do monthly, every other month.
I want to hear about what the patients are saying. What kind of great feedback are you getting in regards to this treatment? What have you seen happen, transformations?
I think one of the most common descriptions we hear after delivering IV ketamine treatments is, wow, that was weird.
Yeah. Absolutely.
And because that's just the introduction, but as patients continue their treatments, they dig deeper into the rewiring of the brain, and that's when talk therapy becomes so significant because they're actually thinking about things differently. And with the help of therapy, they are rewiring their brain.
Oh, that's so true. Sometimes you just need that different perspective.
Reset.
To sort of snap your life back into place. This is fascinating. Thanks so much for sharing it with us. And we also want to let our viewers know where you guys are located. You have 5 Tampa Bay area locations.
We do.
There you see them on the screen. And of course, we can find out all the good information online as well, neurospamentalhealth.com. Thank you, Elizabeth and Amanda, for being here.
Thank you so much.